Hi, and welcome to the New Zealand Veterinary Association webinar series, Disbudding and Dehorning of Cattle. My name is Ash Kewen and I'm the Veterinary Manager for Large Animals here at the NZVA in Wellington. I'm hosting this four-part webinar series, which is designed to assist veterinarians who are helping their farming clients fulfill their obligations under the regulations for disbudding and dehorning of cattle. In this fourth presentation, we will be discussing training of non-veterinarians to comply with Regulations 57 and 58, which relate to disbudding and dehorning of cattle. We will discuss training of local anaesthetic technique, training of disbudding technique, and training of dehorning technique. Firstly, let's talk about local anaesthetic technique. This is essentially a requirement as part of the authorisation process. The ACVM notice and guidance document for VOI make it very clear that the authorising veterinarian must confirm any person understands and can carry out the instructions for use of the RVM and is responsible for ensuring all personnel named in a VOI are trained sufficiently. This training may not necessarily be delivered by the authorising veterinarian. It may be appropriate for a veterinary colleague or a veterinary technician staff to administer the training. However, the authorising veterinarian should be able to demonstrate how they have assessed the competence of the persons using the RVM. All records relating to an authorisation, including training records, must be kept by the authorising veterinarian for 5 years. To comply with the regulation, the local anaesthetic must be appropriately placed and effective. The NZVA Disbudding Training and Assessment Guide can be used by veterinarians to develop their own process for training. However, veterinarians may use their discretion in determining how any training is structured. Now for the disbudding technique. While this isn't a direct requirement of the authorisation process, assessment of the efficacy of local anaesthetic is required during the disbudding procedure. Additionally, under the regulations, any person disbudding must be experienced with or received training in the correct use of the method being used. They must be able to identify signs of distress, injury or ill health, and they must be able to take prompt remedial action or seek advice. Veterinarians have an opportunity to advocate for best practice process and technique if they provide training for the procedure, which is likely to improve animal health and welfare outcomes. Veterinarians should also consider what options are available to most efficiently deliver any training. This may include a group theory session hosted at the clinic with a follow-up practical session at the individual farm. Veterinarians may use their discretion in determining how training is delivered and what the content is. The NZVA Training and Assessment Guideline may be a useful reference, and all training should be appropriately documented and attached to the client file along with the other authorisation records. Lastly, we'll touch on dehorning technique. The NZVA documents refer to cautery disbudding, as this is the preferred procedure which has been demonstrated to cause less pain and distress than amputation dehorning. However, a veterinarian may choose to authorise local anaesthetic for dehorning, and they may train non-veterinarians accordingly. The age of the animal is not specified in the regulations, nor is any particular technique precluded. Although it is worth considering other regulations which do have an age specification, such as Regulation 53, which requires local anaesthetic for castration of cattle over 6 months. To comply with the regulation, the local anaesthetic must be appropriately placed and effective, and any person dehorning must be experienced with or have received training in the correct use of the method being used. They must be able to identify signs of distress, injury or ill health, and they must be able to take prompt remedial action or seek advice. As for any veterinary authorisation, a veterinarian is not obliged to issue an authorisation for local anaesthetic to be used for dehorning if they do not feel it is appropriate. That concludes the fourth and final webinar in the series on disbudding and dehorning of cattle. We've discussed training of non-veterinarians for local anaesthetic technique, disbudding technique, and dehorning technique. During the rest of the webinars in these series, we've discussed the development of the regulations, the key wording of the regulations, and what options are available to veterinarians as they support their clients' compliance. We've become familiar with the 5 resources available to NZVA members to support their clients while satisfying their own professional obligations. And we've explored the 2 avenues for authorisation of local anaesthetic, which were veterinary authorisation and veterinary operating instructions. If you've got any questions or feedback relating to this webinar series, disbudding or dehorning generally, or any other matters, feel free to get in contact with us via email or phone. That's all from me. Thanks for joining me, and thanks for joining us in this whole webinar series. See you later.